Okay. Hello, doctors. Hello, dear warriors. I hope that all of you are managing well. Can you hear me?
Yes, we can. I can hear you.
Good. Okay. So, if you don't know me, this is Dr. Sahar Ali, the former of the PLAB 2 Warriors groups. I do provide full course with mind maps and simulated scenarios. I do provide practical course SimMan, examination, procedure, prescriptions with mind maps and simulated scenarios on a real SimMan. Lastly, I do provide one-to-one mocks with detailed written and verbal feedback as well, with excellent feedback from my candidates, Alhamdulillah. So let's talk about our plan for today. We are going to take two cases, one case from counseling approach and another case from learning disability approach. So we are going to take the first station with one of the doctors in a simulated scenario. I'll give the comment on his marks, and then we will study the mind map of this station together. Then we are going to take the second station. We will do the same as we did in the first station, and after that I will give you golden tips on how to practice as I promised you in the last session. Questions at the end, please, doctors. So let's get started. So thank you, Dr. Ibrahim. So we are going to take you, and if you can write down in the chat box, doctors, anyone who wants to practice the second station, I will be grateful. So let me share the screen. You will have 1.5 minutes, Dr. Ibrahim, to read your question, and then we are going to do the simulation. All
All
right.
right.
Let me share the screen. Just a second, Dr. Ibrahim. So you will have 1.5 minutes, okay? From now, read your question, please.
Okay.
Start, please.
Hello, I'm Ibrahim. I'm one of the doctors here. Is this Matthew Blake, age 52?
Yes, doctor.
Hello, Matthew. How would you like me to call you?
Call me Matthew. It's fine, doctor.
Okay, nice to meet you, Matthew.
Thank
How
you.
can I help you today?
Yes, doctor. I've been referred from the optician. He told me that I have a problem in the back of my eyes because I had some blurry vision since 2 months, and it was getting worse. So then he referred me here to the GP.
Okay. Do you have any idea why this is happening?
He told me maybe my diabetes. I think this is the time to control my diabetes, doctor.
Okay. When were you diagnosed with diabetes?
5 years ago, doctor.
Can you tell me more about it?
Okay, so I have this diabetes and it is managed with insulin. Okay. I take my insulin as prescribed. Yeah, but I don't know why it is not controlled, doctor. Yeah.
Okay. I will check your prescriptions and we will talk about it. But first, let me ask you a few questions to understand what is going on. Is that okay?
Okay.
So, how do you use this insulin?
I am taking injections, long acting and short acting, Novorapid in the morning 3 times and Lantus at the evening. Yeah.
Anything else?
No.
So you take it the short acting once a day?
Three times a day.
3 times a day.
Yes.
And do you are you compliant with this?
Yes, I'm taking it as prescribed.
You're taking the insulin as prescribed, but you say still your diabetes is not very well controlled. Am I
Yes.
understanding all right?
Yes.
Why do you think is that? Do you have any idea?
I'm not sure, doctor. I'm not sure.
Okay. Do you, my nurse colleague told me that you have some other problems also. Can you tell me more about them?
Okay, so I don't know about your nurse colleague.
Oh, okay.
Yeah.
We have taken some urine sample from you.
Yeah.
And she has done some neurological examination of your hand and feet. Did she
Yes.
give you any feedback about this?
Yes, doctor. I have my feet are sore, doctor, since 2 months. She has examined me, but she didn't tell me anything.
Okay. So let me ask you some questions. Have you been going to your follow-ups regularly?
To be honest, no.
No. Do you measure your blood sugar regularly?
No, doctor.
Do you have a good diet? Tell me more about your diet.
I'm trying to eat healthy, okay. But sometimes I like fast food and these things. I like this. Yeah.
Like generally, what do you eat? Like what is your diet consists of?
Um, everything, everything, doctor.
Okay. What about exercise?
No, I don't have time, doctor.
Okay. Why do you don't have time?
Because of my work, doctor. I'm working in an office job, so I don't have time to go or to have like exercises and these things. Yeah.
Okay. We'll look into that. What about alcohol?
No, I don't drink, doctor.
No alcohol. Okay. So I would like to tell you about these results that we have, Matthew. Your results show that your sugar levels are not very well controlled. Okay, and because of this, some of the complications of diabetes are already happened. Did you know about the complications of your condition?
No, doctor.
Uncontrolled blood sugar might cause to kidney damage and like some peripheral nerve damage, which means like in our hands or in our feet, and it might cause eye damage.
Okay.
Are you following me?
Yes. So do I have
Do you
these,
have
doctor?
any questions so far?
No. So do I have these, doctor?
Unfortunately, from our assessment, you have some of these complications.
Oh my God. Okay.
Yes. And I'm sorry to say that these complications are not reversible.
Oh my God.
But we can still do a lot of things for you. We can control your blood sugar well, and in this way, we will prevent these complications to become even worse.
Okay, doctor.
Okay?
Okay.
For this, we need to do regular blood sugar. You need to do regular blood sugar testing. You have to measure it daily at first, and you need to go to your follow-ups with your GP so they can arrange this dose for you and they have a good sense of understanding what's going on. And beside that, there are lots of things that you have to do. It's up to you. You can change this.
Okay, doctor.
Do you understand me?
Yes.
If you have follow a good diet, if you drink lots of water, and if you do physical exercise, controlling of your blood sugar would be much easier for us.
Okay, doctor.
Okay. And beside that, because you have these complications, we are going to refer you to ophthalmologist to control your eyesight and give you some treatment if necessary. And we are going to refer you to the diabetic nurse. They will give you detailed instructions about how to care about your food and how to make it clean. And I'm going to address it shortly, but they're going to give you more detailed information. And beside that, they're going to teach you how to follow your blood sugar and more knowledge about these readings. Is that understood?
Yes, doctor.
Do you have any questions for me?
No, no, thank you, doctor. Thank you so much.
Do you have any concerns, any expectations from me? Because after this, I'm going to explain how to care about your food and your other stuff, other results.
Nothing specific, doctor.
Okay. First of all, I would like to address the time is done?
Yes.
Oh, okay. I thought you were going to give me some warning for like 2 minutes left or something like that.
It has happened. 2 minutes left, but maybe you didn't hear because yeah.
Oh, okay.
Okay. Thank you so much, Dr. Ibrahim. So, how do you
Thank you.
feel?
If I knew that I had 2 minutes remaining, I would have, wrapped it up in the last 2 minutes. Otherwise, I acted more relaxed way.
Okay. Is there any other thing? Maybe you were. What do you think? Were you patient-centered or doctor-centered a little bit?
I was trying my best to become patient-centric.
Okay. Do you think answering or telling the patient that you need to do and we will do and the nurse will do and you have to do this, is it a kind of like giving
Maybe.
orders to the patient a little bit?
Yeah, maybe I didn't realize until you said it.
Yeah, so this is the only thing, Dr. Ibrahim. If you can work on this, you will be more patient-centered. And also, like, don't tell the patient or avoid telling the patient, this is up to you. You need to do this, and you need to do this, and the nurse will do this, and the nurse will do this. Do you have any concerns? So you're telling me you're going to do this, okay? So do you have any questions? Do you have any concerns regarding this? No, not like this, Dr.
Actually, that's what I do in my daily practice. I was just I started to do it because of like patients feel so powerless because of the disease. They feel like they can't do anything. All they can do is like go to follow-ups or take this medication and that stuff. And I'm telling them continuously, like, you have the power. You can change this.
Maybe.
But maybe I didn't phrase it I should have phrased it in a better way.
Yeah.
How do you think I should have told it?
Okay, so we will talk about this. Don't worry about that. So if you can avoid like telling you have and we will and these things, you can tell him what do you think if we can do this and this, and what your thoughts about this and this and this. Would you like to hear about this, Mr. X? I think that your diabetes is not controlled because that you're not going to the follow-ups, and you don't go to you don't monitor your blood sugar. So what do you think if we can focus on this a little bit and follow a lifestyle, a more healthy lifestyle? Would it be all right with you? What do you think? Do you think you can do this? Okay, so this is how to be like patient-centered, giving the audio to the patient and check with him, can he do this or not? If he can't, so you will try to find out another solution. This is your counseling skills, okay? And we are going to talk about this, okay?
Yes. Okay. Thank you.
So thank you, Dr. Ibrahim. So let me give you the marks. Like in data gathering, I don't have any problem in the data gathering. Let me just check the pointer. Okay. You asked me almost all of the questions, but you didn't address the psychosocial part.
Yeah.
Okay. So in counseling, it's really important to check the risk factors and the circumstances of the patient. Maybe the patient has a problem in his life caused this uncontrolled diabetes, or this
Yes.
his uncontrolled diabetes affected his life. So
Mm-hmm.
it's better to ask psychosocial. So I would give
Mm-hmm.
you three in data gathering. In the management skills, I would give you, you addressed all of the points in the management, but I think they will give you two, not three in the management because of your IPS, the patient centered approach.
Mm-hmm.
You were doctor centered a little bit. Okay.
Mm-hmm.
So a tick in the rapport. Okay. And in the management as well because of the doctor centered approach. Okay. 3216. Okay.
Okay, thank you.
Thank you, Dr. Ibrahim. It's just about the technique. It's just about the technique. You still have plenty of time to be a patient centered. Just a few phrases. Just give the idea to the patient. Check with
Mm-hmm.
him. Is it okay with him or not? And that's it.
Okay, thank
Okay,
you.
so don't
It's been very
don't worry,
helpful.
don't worry. It's just
No, I'm
about,
not a warrior.
yeah, just small few things and you will be okay,
Mm-hmm.
inshallah.
Okay, thank you.
Okay, thank you so much. So let's talk about our station. This station is a counseling station. If we can talk about counseling doctors, we can say that counseling is giving an advice to the patient, and they want to see your counseling skills in these stations. How would you give the advice to the patient? How would you guide the patient and assist the patient in their condition? How to give them the proper advice on how to control their problem, how to deal with their problem, giving them options and solutions based on their circumstances and based on the whole situation of the patient. All right, so this is regarding counseling. So you will start, let's first read the question, because I always like reading the question because this is our guide. Who are you? You are FY2 in the GP surgery. Who is the patient? Matthew Black, aged 52 years, diagnosed with type 1 diabetes mellitus. He is on insulin. Additional information: examination has been done by the nurse. He has loss of fine sensation and pain below ankle bilaterally. Urine test has been done and shown positive glucose and protein. So he has diabetic neuropathy and nephropathy as well. The patient has been seen by the optician. Fundoscopy has been done and showed dots and blots. It is retinopathy. The plan is to refer the patient to ophthalmologist. So this is your plan. Okay? This is the main plan for you. They give you the management. His prescription was 1 month old. So by this, what they want to say to you, please review his medication, or give him, check if his um, tablets are with him now or not, and give him another supply and review the dose. All right. Your task: talk to the patient about diabetes control, and discuss initial management, the initial steps in his management. Please do not examine the patient. So please do not examine the patient. All right? It's written here. Okay? Okay. So your task is to talk about the diabetes control, how to control his diabetes, And what is the next step? The initial step of the management? Here it's the referral of the ophthalmologist and other advice to the patient. All right? Okay. So this is our lovely map in this case. You will start by greeting the patient and introducing yourself. Then you will take your present history. In the present history, recap. And please, in any counseling stations, doctors, try to recap from the question. Don't ask the patient or don't tell the patient, how can I help you? Try to say to the patient, I can see that you are referred from the optician, or I can see that you have diabetes. So how are you coping? And this is your follow-up. How is everything? Can you tell me in your own words? And these things. By this, you show the patient that you are a caring doctor. You know about their condition rather than telling them, how can I help? Okay? How can I help is okay in history based when the patient is coming for the first time, but if he is coming for his follow-up and also there are more information in the question, so use these information. Okay, so this is regarding the first thing, recap from the question. He has a problem in his eye, or he has blurry vision, so try to explore quickly. Since when you have this, do you have any other problem in your eye? That's it. Okay, this is a counseling station, it's not history based. You have lots of things to do in this station. All right. Your red flags here, you can ask about flank pain and swelling in the legs, just to exclude renal failure. That's it. Okay, then you will exclude the risk factors. This is the most important thing in present history in counseling. Try to find out the risk factors of the problem, of maybe why this problem is uncontrolled, or the risk factors of having this problem. Okay, and you will address these in your management. All right, so the risk factors are here, the personnel, and the first point in this black box, the compliance, the control. Is he monitoring his blood sugar? Is he going to the follow-ups? Is he going to the annual checkup of the eye? And also the data or the personal history. All right. Then please ask about if he has any complications of diabetes. Here you can skip this point because already you have asked this in your present history. He has already blurry vision and sore feet and these things. Okay. After that, ask him, are you aware of very low and very high blood sugar symptoms? If yes, it's okay. If no, so tell him, I'll make sure to teach you what are the symptoms and how to deal with them if you have any one of them. All right? Then you will move on to your past history. Any other medical conditions? Any medications apart from insulin? Any allergies? Family and travel is not important here. Okay, then the personal history. Can you tell me regarding your lifestyle? Can you tell me a little bit about your diet? Do you think that you are eating healthy food, Mr. X? Yes or no, whatever. If yes, praise him. If no, address that in your management. All right. Exercise as well. Smoking and alcohol, you can ask, you can skip, it's okay, no worries. Okay, then move on to the psychosocial. Tell him, you mentioned to me that you have blurry vision and also this sore feet for 1 or 2 months now. So, how is your daily life activity? Is it affected, Mr. X? Do you have any problem with your job? Okay, how about your mood? If you would like to ask about mood, it's fine. If you don't want, it's okay. But ask about the effect on the life and the job, okay? And ask about driving, okay? Because he has blurry vision. Maybe he's driving, so you need to address this in your management. All right? Then you will move on to your ideas, concerns, and expectations. Ideas, you can ask it here. Okay, we will do this together. Ask him, do you have any concerns at all? Any specific concern regarding your condition, Mr. X? If he is concerned about something, ask him why you are concerned. If he doesn't have anything, so move on. Here, you don't need to examine, just tell the patient, so Mr. X, the nurse and the optician have seen you, okay, and they found some findings. Would you like to hear about these findings? Yes, please, doctor. Okay. So the nurse has checked your vitals, and also the optician has checked your eyes, and the findings or the examination showed that you have a problem in your sensation in your leg. In addition to that, you have a slight damage in the back of your eyes. That's why you have this blurry vision. In addition to that, your urine test showed that there is some protein in your urine. Do you know what does that mean, Mr. X? No, doctor, what does that mean? So this means that unfortunately, the uncontrolled diabetes has affected your eyes, your nerves, and your kidney as well. So, what do you think if we can talk about this and about the control of diabetes, Mr. X? Yes, doctor. I've already told you that I want to control my diabetes. So praise him. If he tells you this here, or if he tells you this here in the start, I need to control my diabetes, tell him, I'm glad that you have taken this decision. We will support you in this. All right? Then tell him, so what are your ideas about the risk factors of uncontrolled diabetes? So you can use ideas like this. All right? Then the patient tells you, doctor, I don't have very much, doctor. I don't know anything about the risk factors or these things. So tell him, okay, so there are many risk factors that influence this. We can talk about the risk factors in your case in our management plan. So would you like to hear what is our management plan? Yes, please, doctor. Okay, so let's discuss together. Let's discuss together. Okay, what we can do for you, what you can do for yourself, and also definitely we will follow you up. Which one would you like to discuss? Or you can tell him what we can do, what you can do, and also we will provide you with the leaflets, and I will tell you some safety measures after that. So which one would you like to discuss, Mr. X? Whatever you want, doctor. Or tell me what you can do for me, doctor. Okay. So the first thing in what we can do, we will review your medication. Do you have any supply for your medication? Yes or no, based on this, give the response. Then the second thing, we will refer you to the eye specialist to check your eyes. What do you think about this? And at the end, I will teach you what are the symptoms of very low blood sugar and very high blood sugar, and how to deal with them. All right, Mr. X? Yes. Okay. The most important thing, which is the cornerstone, the risk factors. I have told you that there are many risk factors. So in your case, You have mentioned to me that you don't go to the follow-ups, you don't monitor your blood sugar, and also you have missed the last annual checkup. So it's really, really important to go to the follow-up, to monitor your blood sugar regularly, Mr. X. So what do you think about this? Do you think you can do this? If yes, okay, move on to the next point, which is the lifestyle. If no, tell him, okay, so let's think together. Um, is there any problem preventing you from going to the follow-ups or these things? Okay, so it's based on the patient's response. Respond based on this. This is how to be patient-centered. Okay, don't give the patient orders that you need to do this, you need to do this, you need to do this. The patient will be like shocked from the way, or he will be like, okay, so I'm listening, and it's okay, I'm not going to follow this. All right, but when you involve him, when you try to find solutions to him, when you try to consider his circumstances, this is how to be patient centered. All right, after that, if there is a time, and if he is driving, give him an advice about driving, and then tell him, we will be happy to see you again. Do you agree on this, Mr. X? Yes, doctor. Yes, doctor. Thank you and thank you. Okay, so this is regarding the first station. Okay, so let's do the next station. Let's do the station, and whatever the problem is, just focus on how to perform well in your exam. That's it. Okay.
Okay.
Okay, thank you, Dr. Abdullah. Thank you so much. All right, let me share the screen. Can you see my screen? Hello. Hello.
Yes,
Can
doctor.
you see?
Yeah.
Okay.
Yes.
Okay, so you have
Uh,
1.5 minutes. Read your question, please, and then we are going to start. Start, please.
Hello, my name is Dr. Fatima Naushida. Could you just confirm your name and age, please?
Yes, doctor. I'm Catherine White, and I'm 55 years old.
Okay. Hello, Catherine. How are you?
I'm fine, thank you, doctor.
Okay. So, in my notes, I see that you were discharged from the hospital. So, could you just tell me what happened?
Oh, yes, doctor. I had a clot in my leg,
Okay.
and yes, they gave me the tablets, and this is my follow-up.
Okay. So, how are you now? Are you feeling all right now?
Yes, dear, I'm fine.
Yeah. Okay. Okay. So, is there something concerning you?
Um, Nothing specifically, doctor, now, no.
Okay. So, are you taking your medicines regularly?
You mean the tablets? Yes,
Yes.
doctor.
Yes.
Yes,
Oh.
I take it, like, they told me how to take it, but I didn't pay attention at that time.
Okay.
So I think I should take it when I have pain.
Okay. So you haven't been taking it regularly. So you only take it whenever you have pain, is it?
Yes, dear.
Oh, okay. Okay. So, do you have any chest pain now?
No,
Any pain in your legs?
no,
Okay. Any swelling in your legs?
no,
Any breathing difficulties?
no, doctor.
Okay, that's good. That's very reassuring. So, can I know, is there did you have any similar symptoms before the recent symptoms?
No, this is the first time I have this pain in my leg.
Okay, and did you have any other medical illness that we should be aware of?
No, no, dear.
Okay, are you on any medications?
I just take this tablets for the clot.
Okay, okay. So, just some very personal questions. So do you, do you still have your periods now?
No,
Okay, and are you sexually active?
no, doctor.
Okay, so, and I'm sure you're up to date with your pap smear. Okay, is it?
It is, yes, doctor.
Okay, so did you, you said you don't have your periods, so did you attain menopause recently?
Yes, dear.
Okay, and are you on any pills, any hormonal pills?
No.
Okay, that's okay. And how is your diet?
My diet is fine. I'm trying to eat healthy.
Okay, and do you exercise well?
Not really, dear.
Okay, so do you smoke
No,
and do you take alcohol?
no.
Okay, that's good. Could you just tell me any of your family members have any heart diseases or any genetic problems in your family?
Mm, I don't know, dear. I don't know.
Okay, okay. And what do you do for a living, Catherine?
I'm a housewife.
You're a housewife. Okay, that's lovely. So I'd like to examine you right now. We'll be checking your BP and all your vitals. And we'll be checking your weight and height and everything. Okay.
Okay, what is
So,
BB, doctor?
uh, uh, pardon, what did you tell me?
What is BB?
Okay, so it's blood pressure. I'm so sorry. It's
Okay.
blood pressure.
Okay.
So we'll be checking your blood pressure if it's high or low or everything. Okay.
Okay.
Now, as you know, you had a condition called DVT. It is. Uh, just tell me if you're not able to follow me. Just
Is
so
it the
what
clot,
happened?
doctor?
Yes, yes, it is
Yeah.
clot. Yeah, yeah. So yeah, so it was clot that formed in your blood vessels and it caused a blockage. Okay. Now to prevent it, the doctors have prescribed you some medicines that will allow your blood to flow well, so that there are no clots formed in your arteries or veins. Are you following me?
Uh, yes, doctor.
Okay, so the reason why they have given you is to prevent clots. So they expect you to have it daily. Okay?
Okay, so every day you mean?
Yes, every
Yeah.
day. Yeah. So so you need to have it daily. If you're not able to, if you're not able to remember, you could have a reminder, or you could have mark it on your calendar. So that you're sure that you take it every day. Yeah.
Okay. Okay.
Okay, so because there are high chances that you could have similar complaints in future as well. So we are having this medicines to prevent it. Are you following me?
Yes, doctor, but can you please talk a little bit slower than this because
Yes, yes.
I have a problem in when people talk
And this.
in a speed way. Yes,
Yes,
please.
yes, yes, yes. I'm so sorry. Yes, I will. I will surely talk it very slowly.
Okay.
Just stop me whenever you're not able to follow me. Follow
Yes.
me, okay?
Yes, dear.
Okay. So you understood that you should be taking these medicines every day, is it?
Yes, it is. Yes, doctor.
Okay. Now there are some other things you should be doing along with taking these medicines. Okay.
Mm-hmm.
So you said you are a housewife. I know that's a really difficult job you need to do, walk around, you have a lot of things to do at home.
Yeah.
Yeah, how about taking some time to, exercise, some walking and everything? Yeah?
Okay. Okay.
Okay. So make sure you walk around thirty minutes a day.
Mm-hmm.
Yeah.
Okay. Yeah.
And uh, diet, and you should be aware of your diet as well. So you said you have a good diet. Now I want you to make sure you don't have a lot of red meat. You know,
Okay. Why?
you know
Why?
what?
Why?
Uh, because red meat has a lot of fat content, so it increases your cholesterol levels. Yeah?
Okay.
And cholesterol means it's a kind of fat in your body.
Mm.
Yeah, so that can cause more uh, blood clotting. That can cause clotting.
Okay.
Are
Okay.
you following me?
Yes,
So make
following.
sure. And oils, don't fry your food,
Mm.
rather than frying. How about thinking about grilling,
Okay.
barbecuing or grilling in your oven or using an air fryer? Do
Okay.
you have an air fryer at home?
Yes, yes, doctor, I have.
So, yeah, you can use an air fryer.
Time is done. Okay.
Okay. Oh, God.
Okay. Thank you, Dr. Fatima. So, how do you
Yeah.
feel?
I was very nervous. I was very nervous.
Don't worry, okay?
Yeah.
So, you have the exam after tomorrow. So, go
Yeah.
relaxed. Whatever you have, I'm not going to give you any mark. Okay.
Okay. I mean, how about you give me? I mean, you if I don't mind, you don't give me marks, but you tell me whatever I've
Yes, yes, I will
done.
tell
Yeah,
you. I will tell you,
yeah,
dear. Okay.
yeah.
So,
Okay.
um, what do you think this station is about?
It's a counseling station
Counseling with which patient?
with a learning disability patient.
Yes, learning disability patient. So there is a specific approach to learning disability patient, all right?
Yeah,
And we will
yeah.
talk about this. And also, do you think, may I ask you, why did you ask about sexual and pap smear and also what else? I think, yes, sexual and pap smear. Do you think it's relevant in this station?
And no, no, I was just, I mean, she was in the GP setting, so I thought, if you tell she's due for it, I could just remind her for
Yeah.
pap smear as well.
It's not the issue here, okay? So think
Yeah,
about the station, Dr. Fatima. Think about the task that you have, and
yeah,
what is the reason behind giving the station to you. This is
yeah,
a kind of counseling station about DVT, okay,
yeah, yeah,
in a learning disabled patient. So you need to check how to approach this learning disabled patient.
yeah,
What should you use in your consultation to make them comfortable and ready to hear you and ready to understand everything? This is the
yeah,
first issue. Second
yeah,
issue is to advise the patient about the medication. She doesn't take her medication as prescribed. So
yeah,
ask her what's the reason behind this. Maybe there is
yeah,
a problem in knowing how to take the medication. Maybe a
yeah,
problem in the memory. You have addressed this regarding the memory. Also,
yeah,
maybe she has any kind of maybe she have a kind of a side effect from this medication. That's why she doesn't take the medication. So this is the reason behind the station. So when you read the question, please, doctors, try to find out what is the issue behind this station. And when you gather your data based on this. It's okay to ask your questions in an organized way, but it's not okay to ask every and anything. All right? If
yeah,
the personal history is not important in your management, skip the personal history. If the sexual history is not important in your management or based on the issue of the station, skip it. You are not going to and they will not deduct any mark from this. No, they will give you marks because you are to the point and you're focused, and your history taking is based on the issue of the station. Okay.
okay, yeah,
So this is the point. So in your data gathering, please avoid asking about his sexual and pap smear and these things. If the station doesn't need this, you can ask these questions if maybe like postmenopausal bleeding, or gynecological problem. Okay, so you can ask these questions. All right. Okay. Okay. Regarding also, you can also skip smoking and alcohol. It's not very important in this station. So the problem in your data gathering is selecting the relevant questions. All right. Did you get the point?
Yes, doctor.
Okay. So
I'm just going to mute. You can continue. I'm
yes.
just going to
Okay.
mute because there's a
Okay.
lot of
So yeah,
distractions.
this is regarding the data gathering. So selecting, I just need to check the pointer. Yeah. Okay. So the data gathering is, in your case, select the relevant questions, please. In your management skills, it's about approaching the patient. She is learning disabled patient, so you need to approach her in a specific approach. We are going to talk about this now. All right. And to tell her about the medication and how to take it, what is the problem with her, to address this. All right. In interpersonal skills, your way is good with the patient. I don't have any problem with the way, when you talk to the patient, but it's about the approach, the learning disability, specifically the learning disability approach. All right, so let's talk about the station quickly. Before we talk about the station, I just need to tell you some information about learning disability. uh, so I would like to tell you 3 points. All right, the first point is that learning disability is a spectrum. There is mild, moderate, and severe learning disability. Usually in the exam, you will have the mild form, because you don't have too much time to waste with severely learning disabled patients. All right. The second point is to know that lots of learning disability patients are mentally competent. They can work, they can live alone, and they can live the normal life as anybody. All right. The last point is that you need to know what is the learning disability, what is the kind of learning disability, and what is the best way. So, what is the kind and what is the best way that you need to use to the patient to make them so they can understand you. All right. Why you need to know what is the kind of learning disability? Because it is a spectrum. Okay, sometimes the patient has a problem in the concentration. He can't concentrate on two tasks at a time. Maybe the patient will have a problem in the memory. Maybe the problem has a problem in skills, learning new skills, or how to inject himself or how to take the medication. Maybe he have a problem in understanding. Okay, he's talking slowly, and he wants you to talk slowly as well. All right, so ask him what is the kind and what is the best way for me to use to explain everything in the best way. What are the ways that you can use? Like talking slowly if he wants you to talk slowly, like taking paper and pen if you have this in your exam to explain things to him, write down any numbers or any illustration. Okay, so it's based on the station. All right, in this station the patient is having a problem in understanding the medical condition, the medical terms. Okay, so when you ask her, she will tell you, doctor, I have a problem in understanding complex medical words. So what is the best way is to avoid the medical terms and to talk slowly. She has a problem in talking speedily. All right. So you will Start by greeting the patient, introducing yourself, then recap from the question. She is what she's in her follow-up. So tell her, okay, so Mrs. White or Catherine, whatever her name. So Catherine, I can see from my note that you have a clot. Is that right? Yes, doctor. And you have been admitted in the hospital for 4 weeks. Okay, yes, doctor. And also they have given like tablets for you or a medication. She will tell you, doctor, the tablet, doctor. Tell her, yes, okay, the tablets. So they give you the tablet? Yes. Okay, so how are you doing so far? Is everything okay? Yes, doctor. Okay, do you have, so nothing to explore? Okay, then tell her the red flag. Ask her about the red flags. Do you still have any pain in your leg? Any chest tightness? Any kind of shortness of breath? No, doctor. Okay, and I can see also from my note that you have a kind of learning difficulty. Is that right? Yes, doctor. Okay, can you tell me, Catherine, what is the kind specifically and what is the best way for me to use to explain everything in the best way? Yes, doctor, I have a problem in understanding the complex medical words, and please, if you can talk slowly. Okay, no worries. I will try my best to talk slowly, and also I will avoid any medical terms. Is that okay? Yes, doctor. Okay, so you will start by talking slowly. If you feel that the patient doesn't have any problem in talking slowly and he is talking in a good pace, so you can talk in good pace. All right. So you will try to identify the risk factors. What are the risk factors of hair problem? Her INR is very low. So the risk factors are in two categories: the compliance, okay, and others. The others are the personal, diet, exercise, and in the past history. All right. So if we can talk about the compliance, as I mentioned, the compliance is based on maybe the patient has a problem in have a problem in what in how to take the medication, or maybe he have a problem in memory, maybe he have a problem in um, like he has side effects from the medication, so he's not willing to take the medication. So tell her, so do you take the tablets as prescribed? Yes, doctor, I think they told me, but I didn't pay attention. So I think I'm taking it when I have pain. Tell her, okay, so you don't take it like every day. It's just when you have pain. Yes, doctor. Okay, no worries. We can talk about this shortly. Okay, and do you have any medical condition? So the other risk factors. Do you have any medical condition? No, doctor. Do you have any? Do you take any other medications? Any new medication? Any change in the medication? These are the points in the medication. You don't need to ask all of these questions, but just touch on medical conditions and medications, because sometimes hypothyroidism can lead to affection of the INR, and also like if he is taking any new medication or any change in his regular medication can lead to interaction with the warfarin. All right. um, in the personal history, ask her about any change in your diet. That's it, any change in your diet. um, why I'm telling you this, doctor Fatima, you don't need to ask about healthy or unhealthy. I got your point that you need to counsel her about low fat diet and these things, but this is not the issue. The patient has a clot, so it's about the warfarin. She's taking warfarin, so you will try to find out why warfarin is not working. Okay, a change in the diet can lead to affection of the warfarin level and the function of the warfarin in the body. Right? This is the only thing that you can ask. Alcohol is not important. Okay, so don't ask about alcohol. Alcohol sometimes the alcohol can lead to increase the efficacy of warfarin. All right, so if you can skip alcohol, it's fine. All right, then you will move on to psychosocial. So she is learning disabled patient. Tell her, who do you live with? Do you have any problem or any comment on your safety at home? Why do you think you need to ask this question? She's taking warfarin. She's learning disabled. She's 50 years old. So maybe she has a problem or a slippery floor or something like this, increase the fall. And she is taking warfarin. So this is safety measures, okay? If her house is not safe, so you will need to involve the physiotherapist and occupational therapist to give some strategies on the safety measures in her home. All right. What do you work? She's like housewife. It's okay. Okay. Do you have any concerns? No, doctor. Okay, so I would like to examine you, check your observations. Don't tell her BBs and these things. She's learning disabled patient. So I'll check your observations, and also I will do some general physical examination. All right? Would it be okay? And also I have a look on your leg. Would it be okay, Catherine? Yes, doctor. All right. Then you will move on to your management part. Okay, so here, how to explain to her the results and how to explain to her that it's very important to take the medication. Tell her. So, do you know what you have, Catherine? Yes, doctor, I have a clot in my leg. All right. And can you please mute yourself, doctors? Just a second. Okay. All right. Just a second. Yeah. So okay, Catherine. And I can see from my note that you come every week to do some blood tests to check that the tablets are working or not. Is that right? Yes, doctor. Praise her. Tell her I'm very glad that you are conscious about your health, that you are coming every week to do this test. It's it's a very good thing from your side. Please keep on this. Okay? Then I have the results of your blood test now. So can you see and take the paper, show her, tell her, can you see from here? Yes, doctor. All right. So do you have any problem in numbers or any in reading or in writing? No, doctor. Okay. So we do the test or the blood test to check if the medication or if the tablets are working or not. If the tablets are working, as you can see, the blood test should be 2. All right. If the medication or the tablets are not working, so the blood test will be less than 2. And this is the case in your condition. It's below 2. So, do you have any idea why is this, Catherine? No, doctor. Okay, and tell her. So, I think the problem is that you take the medication or the tablets whenever you have pain, and this is the wrong way. The right way is to take the tablet, 1 tablet every day. 1 tablet every day. Do you have any problem in this? No, doctor. Do you have any problem in memorizing this? No, doctor. Okay, that's good. So, can you repeat to me? Yes, 1 tablet every day. Good, good, good. Okay, so I can write down a note for you if you would like. No, doctor, I'm fine with this. Yes, okay, that's very good, Catherine. Okay, so do you have any yellow book and wristband? Yes or no, based on her response. You can tell her we will provide this for you. The yellow book is for any patient who is taking warfarin, okay, um, to what? For the follow-ups and these things, they will show the yellow book to the doctors, the dental doctor or any doctor, to show them that he's taking warfarin, and if his warfarin and the INR is not controlled, so they have a good insight about his condition. All right. The wristband is a kind of red band or something like this to show the doctors that this patient is taking warfarin in emergency situation. All right. If you skip this, it's fine. It's totally fine. But at least you have touched on the issue of the station. All right. Uh, then you will tell her, okay, I'll now tell you some symptoms. If you have any one of them, please seek medical advice or call the doctor right away. If you have any tighter chest, any bad headache, any blue batches in your body, big blue batches, please call us or call the 111 right away. Is that okay with you, Catherine? Yes, doctor. So you tell the patient the alarming symptoms, the clotting and the bleeding in not the medical terms, all right? Because this is the way that the patient can understand. And then tell her, I will be happy to see you again. And do you agree on this? Yes, doctor, and yes, doctor. Thank you and thank you. That's it. Right? So this is regarding the second station and the last station. So let me quickly just what happened? Yeah. So let me quickly talk about tips on practice. Okay? So our tips is about what? About practice. As we all know that practice makes perfect and progress. In addition to that, it will help you in boosting your confidence. And in the next session, inshallah, we are going to talk about confidence and how to gain your confidence. So, why practice is important? Because simply by practicing, you will learn by trials and errors. And this is the best way to progress. Okay? So you practice to be good. All right? So if you are good, why you practice then? Okay? So it's okay to watch and to listen to other people. It's totally great, but you need to practice. All right? So how to practice? You can go in two ways simultaneously. The first way is practicing with yourself. The second way is practicing with partners. All right? And because finding partners is a little bit difficult, so you will start first by practicing with yourself, and then you can add practicing with partners. All right? So let's talk about practicing with yourself first. So we will talk about a few points in practicing with yourself. The first point is practicing in a mirror, and try to make it a habit, please. Okay? To be able to see your facial expression, your body language in the mirror. So it will help you a lot in what? In improving your technique and improving your facial expressions and your body language. Okay? The second point is imitating. I always believe something called fake it until you make it. So fake that you are like a native English doctor until you make it. Try to imitate people who are doing videos like Hippocratics or iMedics, and see them how they react and try to imitate them in front of the mirror. In my course, I do simulate the cases by myself so the candidate can see how to react with the patient and how to be patient centered and these things. The third point is what? Is trying to find an index, a good index for the cases, okay, and take it system by system. Let me show you something. Okay, so this is a sample from the index in our course. All right, let's say that you will take the history taking approach, the first thing. All right, and you are going to study, let's say, eye stations. Okay, so when you study the eye stations, take the index, put it in front of you, and try to practice with yourself on all of the stations. What are the most important points in the data gathering and how to give the diagnosis and the management to the patient? Talk with yourself. So we have the eye stations, we have acute symptoms and gradual symptoms. We have subconjunctival, closed angle glaucoma, optic neuritis, GCA, all of these are acute symptoms. In subconjunctival hemorrhage, the patient will be presenting with acute red eye, a red patch in his eye. So what are my alarming symptoms? High blood pressure and also maybe loss of vision and these things. Let me say to myself how I would give the diagnosis to the patient. So, Mr. X, we have examined you and I have found a batch in your eye, and also with the history that you have given to me. All of this are suggestive of what's called subconjunctival hemorrhage. Have you heard about this before? No, doctor. Okay, so we have in our eyes, in the white, around the white of our eyes, a membrane or a cover called conjunctiva. If there is a small bleed underneath this membrane or this cover, this is called subconjunctival hemorrhage. Then give the prognosis. Tell him it's totally harmless. It's okay, and this is a kind of small bruise. It will go on its own. Then give him the management plan. Would you like to hear about management plan? Yes, doctor. What we can do, what you can do, and these things. So talk to yourself. Give the patient the diagnosis and the management in each station, and so on. Finish all of these by yourself. Then talk to your partner to practice on these stations. All right? This is the third point in practicing with yourself. The fourth point and the last point in practicing with yourself, record. Record yourself, please. Listen to yourself. No one will judge yourself better than you. Okay? So record, listen to yourself, and send the recording to your colleagues. Ask them, so how can I improve? What are the defects and these things? All right? So this is regarding yourself. In terms of practicing with partners, I have talked about this in my YouTube channel. If you can, this is a picture of my videos till now. I talked about the preparation in this video. Facts or PLAB 2 key facts. Okay, I talked about the preparation, how to prepare, how to practice, and these things. Okay, and I have attached to this video in the video description a PDF file about the approaches, the general approaches in PLAB 2. All right. So we have three main types of practicing with the partners. We have group practice. We have practice with one partner. We have practice with multiple partners. Let's talk about group practice first. You can start by group practice. You can gather yourselves like maximum 4 or 5 doctors in one group for 2 or 3 weeks. Try to take approach every day. Try to find out the most difficult stations in each approach. Talk about this station, simulate the station, study together for 2 weeks or 3 weeks. When you finish, go to the practice with one partner. And this is the most important thing. Okay? In this stage, you will practice with one partner. Try to find out good partner from this group or from any other group. Take the stations, all of the stations. Okay? Take like, today we are going to take this approach and practice all of the stations on this approach today. Don't hang up until you finish with the partner all of the stations of this approach. Okay? You can finish all of the stations if you are dedicated and you practice every day in 1 month and a half, something like this. All right? Then you will move on to the last step, which is practicing with many partners, multiple partners. In this stage, I have done like a map for this just to make it easy for you. 2 weeks before your exam, you will divide your time or your day in 2 sessions, morning and evening. In the morning, you will practice with one partner. In the evening, you will practice with different partner, and try to change the partners from day to day, doctors, please, as much as you can. Okay, so in the morning, you will practice 7 approaches. So let me give you a picture of the approaches. We have like 14 or 15 approaches. This is a sample from the approaches in the video. This is the file that I have talked about. We have surgery approach, explaining test results, history-based approach, counseling, and so on. We have like 14 or 15, so divide them. You can take 7 and 7. So in the morning, let's say that you are going to take surgery, explaining test result, history-based, 2 stations from any system, okay? Not all of the history-based. Then counseling, learning disability, psychiatry. So we have 7 approaches. You will take only 2 cases from each approach. 2 cases from each approach. And then you will practice with your partner 1 case each. Okay, 1 case for you, 1 case for your partner on the same approach. All right? Finish the first approach, do the second approach. So you will practice in the morning 7 approaches. All right? In the evening, do the same in the other 7 approaches with another doctor. If you do this, at the end of the day, you will find yourself, you practiced all of the PLAB 2 approaches and 28 cases a day. What if you like you are busy and you have many things, so you can divide the approaches on 2 days. So do only morning session, 7 approaches in the first day and another 7 approaches in the second day, and so on. By doing this, when you go to the exam, you will find yourself, you practiced all of the approaches for 2 weeks. You repeat everything, and you are getting along with all of the approaches. All of them are like stored in your mind. and you will do the stations inshallah in your exam like it will be like the second nature of you, without any thinking, and you will be relaxed and you will be confident inshallah in your exam. So this is 2 weeks before your exam. How to select the cases? You can select the cases like the most difficult stations in the approach, or the most recent ones, the most recent stations 1 month before your exam, okay, from the recalls. All right. Regarding the practical, start the practical 1 month before your exam to be able to practice or to do the stations twice. All right. So we have Simman examination procedure and prescription. Take one case from each category. One case Simman, one case examination, one case procedure, one case prescription in each day. Study the station, practice on it with your partner. I think you will finish all of the stations within 2 weeks. So you will have another 2 weeks to do it again with your partners. All right. So 2 weeks before your exam, you can do something. You can do thing. You can do what? Sorry. You can do the morning session with your partner, and in the evening you can do the practical cases with other partner or with the same partner. All right. So this is how to practice in a proper way in PLAB 2. In the next session, inshallah, we are going to talk about confidence, inshallah. So thank you so much, doctors, for listening and for attending. I hope that it was helpful and useful regarding the 2 stations, and also regarding the tips on the practice. And inshallah, see you again in the I think in 2 weeks. We do the session every 2 weeks.